Hello everyone, this is Dr. Ryan House with Cumberland Chiropractic, and this is our trusty patient, Dr. Ryan Moore. Last week we talked about the first part of a three-part series, and it was addressing specifically the joints of the low back and pelvis, right? So today we're going to do part two, and we're going to go from the top of the low back up toward the neck, so the middle back, the thoracic spine. This is a very, very important section to address joint-wise. One reason, because there are so many joints. There are ribs on each side of the spine. There is joint between the vertebrae of the spine, and these play such a huge role in either the exact cause of a person's pain or maybe even an accessory to that pain, because we see a lot of our day people that are stuck this way or people that have also breathing problems. And all those joints we talked about are super important in fixing those problems. So as was said in the video before, in our office, especially in regards to adjusting, we are not trying to get just as many pops as can pop. What we're trying to do is apply the right adjustment, the right joints to be addressed on the right patient. So examination is key. Here's how we do an examination of the middle back. So I'm looking at his posture first, asking myself, is there too much rounding? Is there too much flatness to the spine there? So just to look, pretty good spine here. There might be some kind of rounding going on here and some rounding going on right here. There's no crookedness side to side as far as a lean, and shoulder blades or scapula, they look a little winged. So I might be thinking about shoulder versus spine there, but that's my assessment. Have a seat, Dr. Moore. Okay, then I've got to go in and press on these things and see how they're moving. So I'm holding the patient here so the body doesn't move, but I'm allowing that motion to happen at the spine. I'm getting it to end range, seeing if the joint is springy. And just like when he was standing, there's some lack of spring right here. Okay, I'm definitely focused on this area here, just checking shoulder blades. There's pretty good motion there. So I'm gonna call that not the thing we need to adjust. Okay, let's have you kind of look up for me. Good. And then back in the middle. So they definitely could use some extension here because it's not playing a role, not helping in the motion of the spine. Take a deep breath in for me, Dr. Moore. And then blow it out. Okay, and then deep breath in again. Okay. The only thing I see here rib cage wise is there's some parts of the lower rib cage that aren't expanding well, so I'm going to address that as well. So two zones specifically for Dr. Moore that I need to work on. So as in our last video, two means to the goal. Number one, the palpation, the problems that we found better match the adjustment, right? That's pickiness, that's being specific. Number two, we're gonna go from the most effective, quickest way to get to that goal first, and here's that, okay? So he had a problem where his ribs weren't expanding low. He needs a little flexion in his spine, so here's how I'm gonna do that. I'm gonna cross his arms. Patient will be comfortable the whole time, that's important, okay? So hang on there and relax as much as possible. So I'm gonna lift Dr. Moore. I'm gonna lay my hand where he needs that adjustment, and I'm gonna just let him compress right over where I need it. There's my lower ribs, thoracolumbar junction area. Secondly, he needed some extension in a couple of spots, middle part and upper part. I'm gonna roll him my way. I'm gonna be the boulder under his back that allows that joint to extend. So right there is my important spot. I'm gonna lay him back, kind of roll him over my contact so we get that nice extension. Press there. One more at the very top of his spine. Dr. Moore, you're gonna help me get this motion going. So use your feet to push you that way. There you go. And I'm gonna put a little more there. Perfect. So that would be most effective way. Would you mind sitting at the end of the table, face that way? So we got a goal. We got some reservations about doing adjustments that get the pop, the chiropractic manipulation to happen. Osteoporosis, for example. Stress. He's like, man, I can't stand that pop. It makes me fearful. let's don't do that. Let's do something that still gets there a little less aggressive, a little conservative. So here's what we're gonna do to get that same adjustment to happen. So fingers behind your head, if you don't mind, kind of interlocked. Bring the elbows around just like that. And I can use motions to mobilize that part of the spine. So here's that same area that I need to make sure it extends. I'm just getting there to end range and a little pressure. Feel comfortable, Dr. Moore?
Yep.
Great. So he's comfortable, and I'm making that joint do in a slower, easier way what it's not doing now that it needs to do. Very good. So these adjustments that you've seen are a few of the options that are out there. We choose to do these in this way because we've seen them to be the most effective for getting our goal accomplished. We hope this sneak peek that we gave you today kind of maybe dispels some myths or fears that some may have, maybe even excite about the sneak peek into actually joint adjusting that we do in here. Next week, we're gonna talk about the third in the series about neck, adjusting all the way up to the skull. So please stick around for that. If you like this video, give it a thumb. If you know somebody that needs to see it, share it on your timeline or share it with them. And then if you have a question, comment, leave it below. This has been Dr. Ryan House with Cumberland Chiropractic, where we get you better faster.